Happy Wednesday. I hope y'all are doing great. And tonight, tonight we're going to talk about chronic pain. So this is a topic that so many people struggle with at my practice, and it doesn't seem to be something that, as physicians, we're particularly good at managing. We will put people on meds and never take them off, and the meds have their own issues. So what we're going to do is we're just going to, just kind of rifle through it. And you can, me, if you've ever watched a Facebook Live, you can answer or ask questions along the way. I'll answer them. And then we're going to do some myth busting at the end. And we'll see how you guys do at knowing your stuff about chronic pain. But my job today is really not to just, I'm not here to just tutor and teach. What I'm here to do is to really kind of get in on, what I know in 16 years of practicing obesity medicine and how certain things can help and how certain things can't. And I'm going to give you some real live, data and real live comments about what my experience has been in dealing with pain with patients, what things work, what things don't, some of the changes that have taken place recently that have, unfortunately, some of these things are managed because of political reasons. And so if you've seen certain drugs that used to be out for pain, like opioids, change, and now we're doing medical marijuana and stuff like that suddenly out of the blue. There's a lot of things that have affected that. So at any rate, hi Cindy, welcome. We're gonna start, and we're gonna throw some links over here to the right and ask your questions as we go. Okay, so I think the most important thing with chronic pain that you need to think about is pain leads to decreased movement, and it is really very true. The whole body in motion stays in motion, and body at rest stays at rest. I've not seen anything slow down movement like chronic pain does. And for obvious reasons. If it hurts your knees to walk, then you tend to walk less, or you walk with a walker or a wheelchair or cane, and you can't get as much good movement in. So it's important to keep your body in motion. The other thing that happens too, if you stop walking, is you then get atrophy of your muscles, and it gets harder to walk and harder to move. And before you know it, you are in a wheelchair, and we don't want that for anybody. We really want everyone to live their best life. That's what I'm about, and that's what I'm trying to, to teach you guys and to encourage you to do. So hopefully you'll take something home from what we're going to talk about today for that. All right, so you may or may not know, if you have chronic pain, that you are it does affect your sleep. It does affect other things. It affects your mood. Sleep affects your mood. Your serotonin is not high enough when you're not sleeping, and it also affects your cravings, your eating, and your weight. So it is so important to deal with your pain and deal with it appropriately and get it to go away for good once and for all. No one should be in chronic pain. So, okay, let's talk about what, the different kinds of chronic pain are. And so first of all, chronic pain is pain that lasts for more than 3 months. Okay. So if you just like cut yourself, or you go outside, you trip over a rock and you sprain your ankle, but it gets better over, a month, that's not chronic pain. Chronic pain is something that you're dealing with consistently on a daily basis for over 3 months. And, there are so many different kinds of pain. And, although, sometimes learning about these things can be a little mundane, it's important to know the different kinds because you treat them all differently. So let's go into that real quickly, because one medication doesn't fit all. Some people think I just take Tylenol for pain, or I just take, ibuprofen for pain. Well, there's certain pains that don't respond to that. So it's important to take the right medication for the right type of pain. So the first one I want to just mention briefly is something called neuropathic pain. And this is pain that's caused by a lesion in your nervous system. So your nervous system is, there's your central nervous system and your peripheral. Your central is your brain, and then the whole spinal cord that goes all the way down, to your tailbone. And then the peripheral nervous system, if you've ever seen like the nerves that go off the spinal cord and go down into your arms and down into your legs and even up into your face, that's all the peripheral nervous system. So there's different things that you use to treat neuropathic pain, and we'll get into that next. So an example of like of central nervous system pain is like, if you have pain caused by a stroke or a traumatic lesion, or you have a disc that's pushing on the nerve, that's neuropathic pain. And then, peripheral is like shingles, right? If you've ever had shingles, you get it in a certain, what we call dermatome, which is a part of your skin that is affected by one nerve. And it's awful, and it hurts, and it tingles. And, a lot of people are getting them lately in their face, and nobody wants that. And it can cause blindness. It's really a very dangerous thing. So you want to treat it with the right type of pain medication. That's neuropathic. Now, many of us know about musculoskeletal pain, and that's a pain that affects the muscles and the ligaments and the bones and the tendons. And, example of that is like neck pain or chronic back pain, pain associated with a strain or a fracture. That's musculoskeletal pain. Inflammatory pain is very, very common these days, and it's caused by autoimmune disorders or infections and chronic, inflammation by things like osteoarthritis and stuff. That kind of crosses over to musculoskeletal a little bit, but still they're treated in similar but yet different ways. Mechanical pain is pain caused by something pushing on the body, a mechanical load. So for example, if you have a tumor that's in your back and it's pushing on a nerve, or it's pushing on a different location causing pain, that's mechanical pain. And then there's a couple of ones that we don't really talk about a little bit or very much, but they happen frequently. One is what's called nociceptive pain, and that's if you get a burn or have a bruise or a sprain. It's pain that has to do with our perception of things. I don't know how else to describe it, but that if you've ever gotten a bad burn, it's indescribable until it gets very, very severe where you don't feel it at all because the nerve is dead. And then you're really in trouble, because then you're going to have tissue damage and stuff. Okay, and then finally, psychogenic pain. Now, I hate this one because it kind of makes me think about some of my colleagues who are like, it's all in your head. You can think of that as the all in your head pain, but it's not all in your head, because what happens is if you're stressed or anxious and you start to get a belly ache or a headache or something like that, they call it psychogenic pain, which doesn't mean that it's all in your head. It means you have something that's affecting you, which is causing you to have pain or a headache or diarrhea, even stuff like that leads to things because of your nervous system and your emotions, but it can cause other physical problems. A great example of that is if you get it like a migraine headache and it's because of stress at work or something like that. It's in your head, but it's not in your head. And we have to be careful to not chalk those things up to, that person is, just looking for drugs or whatever. Because a lot of times, you know your body, and when you're in pain and it's for a reason. And even if it is related to something that is psychological, it's still important that we treat that issue so that the pain goes away. All right, so those are the different types of pain. And what I'm going to do now is just kind of go through, what do we use in medicine to treat pain, and why would you choose certain things over the others? So I'm going to go first through the pharmaceuticals, because it's important to know that if you're taking something over the counter or you're taking something prescribed by your physician, how long should you take it, how much, and how does it work? Okay, so probably, this is where the glasses go on. They may come off, we'll see. Probably the most common one that I see people on is what we call NSAIDs, which are our anti-inflammatories, non-steroidal anti-inflammatories. And this is actually used for pain that involves inflammation. Okay, so that's important. So if you've got pain that is causing inflammation, Motrin or ibuprofen, or other names are Advil, naproxen is another one, Aleve, okay? All of those are anti-inflammatories that help with swelling, inflammation, and then pain related to that. So that's the musculoskeletal inflammatory pain I mentioned. The way they work is they actually stop certain enzymes in your body from being released that lead to the pain. So a very important one you may have heard about is COX, and there's COX-1 and COX-2, which are involved in when tissue gets damaged. What the NSAIDs do is they inhibit COX-1 and COX-2 both, which help to relieve the inflammation and relieve the pain. So these drugs are popped all the time by a lot of people, and I have to be real careful to look at certain things in my patients, because anti-inflammatories are not benign, and they can cause damage if you're taking too much or taking them for too long a period of time. So I think I said how the way that they work, but they basically inhibit the enzymes that cause pain and swelling, like COX. Okay, but the benefits are they do decrease swelling, so they're great for inflammation. They do reduce pain. But you have to be so careful about how much to take and not take too much too frequently, as I mentioned. And this is what can happen if you go above the recommended dose. So if we're just talking about ibuprofen, for example, the highest dose you should ever take, and this is a very high dose, is 800 milligrams 3 times a day. Now, with these meds, you always need to take them with food, because what happens is with anti-inflammatories like NSAIDs, you actually affect the protection that our body uses to protect our stomach when we have inflammatory problems. So when you take too much, you can actually get ulcers. You can get it can cause kidney damage long term. It can cause problems with your gut in general. You can get bleeding in the GI tract in different places. So, these are things that we can find if we look as doctors. So if someone's having really bad anemia, and, we know they're losing iron somehow, some way, that can be related to something like that. The way that I tend to find out that my patients are taking too many of these drugs is I will look at their kidney functions, and their kidneys are just like completely out of whack. So their filtration, how effective the kidneys work, is dropped down dramatically. There's something called the creatinine that we look that is raised. And as soon as you get them to cut back or even off these drugs, those things return to normal. So those are the important things with anti-inflammatories like NSAIDs. So what I've done with all these, I put my little summary at the end. So my summary on these is they're great for acute pain, especially if you have like a acute injury, like you sprain, your ankle or pull a muscle or something like that. What's great about NSAIDs is they do affect the inflammatory component of it. But I have so many people that are on these drugs forever at super high doses that are tanking their kidneys. And if I hadn't checked the blood work, they'd never know. They don't feel it. Or have something going on with their belly that they're chalking up to something else. So it's super important to take as little as possible. Always take them with food. And if you can, kind of mix it up a little bit so you're not just taking the NSAID so that they don't negatively impact your health. Hopefully that helps you with that. And then the other thing I would say, which we don't really talk about enough, is try to fix the root of the problem. So if you're in chronic pain because you pulled your back out, do the type of stretches you need to do. If it's lasting for too long, consider getting PT or something like that. Don't just pop pain meds to keep going, because what's going to happen is it will get you in the end if you're not careful. So do everything you can to address the core problem there too. All right, the next is acetaminophen. And we all know acetaminophen as Tylenol, or mostly Tylenol, I guess, is the name brand, but there's also, the different type of pharmacy brands out there too. And the way that it works is this is just a pain medicine, so it doesn't affect inflammation at all. So all you're doing is you're tackling the pain in your body, and you're not actually fixing anything problem-wise. Now, if you're taking acetaminophen because you've been out partying and you want to you want to take it so that you can get up and go to work the next day, you have to be so careful because it affects the liver. And they've done some recent studies not too long ago where they showed it doesn't take a lot of alcohol to compound the nasty effects of acetaminophen on the liver, and you can run into a lot of trouble. So it's better to take something else other than Tylenol for that. But anyhow, the way it works is it blocks the production of prostaglandins in the central nervous system. Remember, central is your brain and your spinal cord. And it really works to take care of the different substances, including prostaglandins, that are produced that affect pain and inflammation, but they do not decrease inflammation. Okay, so very big difference between NSAIDs and Tylenol is pain only. NSAIDs are pain and inflammation. So yeah, so this is a good point, Cindy. So sometimes you don't know, do I take Tylenol? Do I take, Advil? So if you have something that is inflammatory, okay, so arthritis, you have an autoimmune disease that causes you to have different types of joint pain. You have an acute injury where your ankle's swollen and it's inflamed. That is something that you want to do the anti-inflammatory for, like NSAID. And then Tylenol is strictly pain, pain, pain. So Tylenol's not going to fix anything but make you feel less pain. That's all it's going to do. Okay, so if you're looking for something that's going to actually start a repair process in whatever's causing you the pain, Tylenol's not your answer. And then the other thing with Tylenol, which I think is really, really important, we've already talked about the alcohol. You've got to be so careful with alcohol and Tylenol. I was very shocked by these studies when they came out showing the potential damage that alcohol can cause to taking concomitant Tylenol use. It's really unbelievable. So if you're drinking, don't take it. That's my recommendation. The other thing too is there's something called rebound headaches that people get. So if you're someone who's a regular acetaminophen user and you're getting headaches, you pop a Tylenol, you're getting another headache, maybe you'll pop two, maybe you pop three later because you're worried about the headache's going to come. This is so dangerous because you can get what's called rebound headaches, which is your body is now so confused about how to deal with pain that it will shoot you pain waiting for the Tylenol to come in. So you have to be really, really careful of that. That's something we see in our field quite a bit. Okay, and the highest dose of Tylenol that you should ever take is a total of 4 grams. So if you're taking 500 milligram Tylenol, which are the extra strength, that's 8 of those. It's not much. And a lot of people can overdo it, so be so careful with that. All right, so my summary with this is I don't really recommend Tylenol very much for people. Like if you have acute injury and you're really in a lot of pain because something just happened and you don't want to take anything stronger, okay, Tylenol will get you out of pain for a period of time, but it isn't doing much more than that, and it can cause the problems that we mentioned. So I really kind of stay away from it as much as possible, and tell my patients, unless you got something really bad going on that's causing you acute pain, just don't take it. All right, so hopefully that helps. And next one is COX-2 inhibitors. So what are COX-2? I don't know why I'm so itchy. So COX-2 inhibitors are, well, I was playing with 2 dogs right before this, so that might have something to do with it. COX-2 inhibitors so basically what they are, they're a newer form of NSAIDs. Now, ibuprofen will take care of what's called COX-1 and COX-2, okay? The COX-2 inhibitors have less GI side effects, so less of that tummy problem, ulcers, GI distress, because they only work on COX-2, which takes care of the inflammation and pain, but they leave COX-1 alone, which helps to protect the lining of the stomach. So with these drugs, you have, they're much lower risk for GI bleeds and things like that. They're not at lower risk for, kidney problems, unfortunately. But if you got an older patient, or if you've got someone who's vulnerable for other reasons to bleeds, these are the right way to go. I like these a lot. So the drugs that you may have heard of that are the COX-2s are like Celebrex or Celacox is Celebrex, and then many people are on meloxicam right now, which is Mobic. And so given the choice between Motrin and like a COX-2 inhibitor, I would choose the COX-2 because it's just safer and prevents the stomach component. So it's so weird, though. I will tell you this, just a little story, that these drugs were taken off the market and then suddenly came back on recently. And maybe I'm in the dark, but I just don't know that there was any data that showed that they were suddenly okay to use. But now they're starting to be peppered back in the market again. But we're going to talk about natural ways. I think anything that is in the ground that allows us healing, and you're going to find when you do something that's more on the natural side, some things do work, some things don't. Some things, especially if you're getting a crappy quality, aren't going to do anything for you. Either way. But what I like about some of the more natural ways of dealing with inflammation is the side effects are almost zero in some of these things that we're about to talk about, which is great. Okay, so my summary on the COX-2s is that they are safer on the gut, so I would prefer them over Motrin and Aleve and those type of drugs. There is a problem. These drugs can make you dizzy. They can, there's another side effect that's a little different, blood pressure. Yeah, fluid retention and hypertension can be caused by these medications, which we really don't see with Motrin. So there's something else happening there that we're not really too sure about. The COX-2s, are they by prescription only? I think the meloxicam is, I think you might be able to get the Celebrex analog over the counter, or they're both prescription. But I know the meloxicam is definitely prescription. Okay, so that's that. Now, so many of you, if you're dealing with chronic pain, you know that pain isn't just pain sometimes. Pain can cause problems with your sleep. It can cause other aches and stuff, especially if you're rolling around at night and not sleeping and not getting enough rest in general. But the other thing that they can do is it can cause depression. So 67% of patients with chronic pain have some type of psychiatric disorder at the same time, whether it's depression, anxiety, insomnia, whatever it is, it goes along with the pain. Very, very common to see that. So it stands to reason that now, in addition to using antidepressants for depression and sleep issues and those kind of things, we now are using them for chronic pain. Okay, so one of the meds, or some of the class of meds that we're using, I'm gonna grab a water for a second here. There's two different classes of meds, and they are antidepressants in general, and then seizure meds, anti-seizure meds. So let's talk about those. So the medications that we use to help with epilepsy do help chronic pain, especially if it's neuropathic pain. So if you remember from the beginning, neuropathic pain is pain that causes the nervous system, like shingles, to create a pain response. And so when you have ever had shingles, or if you've had anything like that, a lot of diabetics get peripheral neuropathy, also neuropathic pain. Medications like anti-seizure medicines, you may recognize Neurontin or Lyrica. Neurontin is also called gabapentin, and Lyrica is called pregabalin. And these medications are prescribed a lot for neuropathic pain. So if you're someone who has even a slip disc that's causing numbness and tingling, you'll be put on one of those two meds. Now, I like those meds. They work great, but they cause huge problems with weight gain. And a lot of people are put on them, especially the gabapentin, which is also called Neurontin. They can put on high doses 3 times a day. And so now what can happen, and what I see fairly frequently, is these medications, you're on them, you're on high doses, and now you're starting to gain weight. And, a typical weight gain with high doses of Neurontin can be 50 pounds in 4 months or 4 to 6 months. So it's very, very significant. So one of the things I do in my weight loss practice is I look at how much of these medications people are on when I'm doing a whole, canvas through their medications. And I try to get them on as little as possible. So even if I don't do anything else to that person, if I can cut down their Neurontin or their Lyrica, the pregabalin, they will start to lose weight because they're such a weight gaining med. So you want to fix the problem acutely. I love these drugs for an acute issue of, shingles. It's a great example that we use Neurontin for that, or Lyrica. And that kind of pain, if you've ever had it, is the worst ever, especially if you get it behind your eyes. It's absolutely horrible. And that medication does work for that type of a problem. But what you want to do then is get off of it once the problem's over, shingles goes away. Then you want to really step away from that medication and stop it, because at that point it's not doing anything. And I do see these prescriptions getting refilled over and over again, and patients are afraid to stop taking it because they don't want that pain to come back. But now they're gaining weight, so now they're having other complications that causes chronic pain from the weight gain. So this is what we tend to see. And I think in general, as we go through these medications, especially the prescription ones, it's important to understand that, as doctors, things have changed in the way we prescribe. So I was actually just talking to Cindy about this earlier today, and that is we now things are automatically sent to us from the pharmacy. And we have to, it's a pain, it's such a pain in the butt. And I wish they never started this process. It's terrible for doctors, and all it does is make money for the pharmacies and for the 90-day suppliers, which is the whole purpose. They've all got deals going on. But what happens is we get automatic refills that we didn't ask for. And then it comes into our inbox and it keeps slamming our inbox until we address it. And I probably spend 2 hours a day going through these things, because then you got to look at what the patient's on. Maybe, one of my other providers saw them, and you got to see, do they need a refill? Did they get a different dose? Like, it is just the most horrible practice that they put into place without even, asking doctors really. And so what ends up happening is we sometimes can prescribe something that we didn't, refill something that we didn't prescribe because it's just automatically sent to us. And, or we're like, well, the patient's not complaining, so we might as well, whatever, keep them on them. I mean, I know the thought process that goes on with that. People get kept on medications that they shouldn't be on long term. So, that's an important thing to understand too. Always look at your meds. Look at your meds regularly. I have people who take medications. They don't even know why they're taking them. They don't know what they're for. They're just, my doctor told me to take it, and they don't need to be on half of them. And so it saves them a ton of money if they can get off them. And also it helps their life long term. So anyhow, I just went off on my rant, but I want you to understand that it's a really important thing to look at your meds, because we are not on the ball anymore as physicians with that, because we now have input coming in from so many different places telling us what to do, instead of just letting us write these meds when we need to with refills as appropriate. Super, super annoying. Okay, I'm done with that. So we were on the antidepressants and the anti-seizure medications. And that's a very good point, Cindy. People are afraid to question their doctors, and always question your doctor. If you're on, I always tell people, and I think I've said this before in Facebook Lives, before you go into your doctor's office, go through your meds and say, do I need to be on this? Do I need to be on this? Do I need to be on this? And ask why, And if you're not happy with the reasoning behind it, or you think maybe, I don't think I need this for my blood pressure. I've lost 20 pounds. Let's try to negotiate me getting off of this. That's not an unreasonable thing to do. Okay. Okay. So we talked about the anti-seizure medicines. There's some antidepressants. Again, these drugs, antidepressants, both old and new, in general, tend to be weight gaining. The older ones are worse. So we see a lot of people using things like amitriptyline and nortriptyline for chronic pain. These guys are huge weight gainers, huge, huge, huge. So you definitely don't want to be on those long. And they also have a ton of side effects. Now, the SSRIs, or the SNRIs, they're called, that are the reuptake inhibitors, the newer drugs, especially the newest ones, which tend to be more effective from a serotonin standpoint and not have as many side effects, aren't as bad. But and there's some that are weight neutral, but medications like Cymbalta can be weight gaining. I see things like Celexa, and even some of the old ones like Zoloft being used for pain. Those are both really weight, Celexa. Yes, those are quite weight gaining. And so we have to be so careful if we're going to use those for chronic pain, that we don't now make the patient depressed, having weight gain, and then end up as a diabetic, a hypertensive, and having high cholesterol and all sorts of other issues. So we have to be careful of that. Okay, so the way these medications work in general, they can take a little while to kick in, all of them, especially the SSRIs and the antidepressants and the anti-seizure medications, really. It can take as long as 4 weeks for the SSRIs to kick in. So you just have to tell people to be patient. And these guys, though, however, can be very, especially as I mentioned, Neurontin, Lyrica, they can be very helpful for the shooting, stabbing pain that you get with an acute injury, or with shingles or other type of neuropathic pains like that. So benefits and risks. So the side effects can include nausea, dizziness, drowsiness. We already talked about weight gain. And then they can sometimes, you have to be careful, because not every antidepressant is the same in every person. It can adversely affect mood for that particular person. So, if I'm putting somebody on Tylenol for pain, I don't really have to worry about their mood. But if I'm putting them on an antidepressant for pain, now I got to watch and see, does this actually make that person worse? So we have to be very careful of that. So my summary is this class of drugs is really like a double-edged sword because you fix one problem, okay? So definitely for shingles and stuff, where you've got an acute, significant pain, I love Lyrica and Neurontin short term. But what we can't do is prescribe these things and then automatically refill them and not pay attention to patients' weight gain and their blood pressure and their sugars and things like that. Because as you continue to use these, you got to watch for that weight gain, which can cause a whole lot of other problems. So that is my 2 cents about that. All right, so I think that's really all of the medications that I want to talk about that we prescribe. Now what I really am excited to get to is to talk to you a little bit about some of the more natural ways to deal with chronic pain, because we have some really good data on a couple of things. And these things in particular, which I'm going to mention, are game changers in my practice. So turmeric and curcumin. So just so you know, turmeric is a spice. It's yellow and it tastes yummy. If you've never used it, turmeric tea is around and it's absolutely delicious, and you can use that. And if you're going to have tea anyhow, you might as well have something that has anti-inflammatory properties. So there is a component of turmeric called curcumin that is a polyphenol that delivers anti-inflammatory benefits, and it really functions as a COX-2 inhibitor, just like the medications we were talking about, Celebrex and meloxicam. So it is very effective with arthritis and chronic inflammatory pain. And there's over 100 studies that show just what a huge difference it makes long term. That curcumin is super, super powerful. So there's a lot of different forms of turmeric coming out. You're seeing it all over the place now because the studies have really kind of risen and recently come to light. And so everybody's coming out with their brand of turmeric. So what I'm going to tell you is this: be so careful when you purchase these, if you're going to purchase them over the counter or at like a drugstore or a supermarket, because there are so many nasty fillers in these things that it's not even funny, and it's really pervasive. So the things you have to be so careful of looking for is there's something they use to make it more yellow called mentanil, mentanil. So it adds color to the turmeric to make it more yellow and appealing, I guess. But it is very, very harmful to the body, at least in animal studies, showing problems with a bunch of different diseases, too many to mention. So you don't want to have that in your supplement. Remember, supplements are not regulated to the same degree, if at all, compared to pharmaceutical medications. And in the supplement category, there's medical grade, which are the highest regulated. The FDA gets involved in those, to nothing. Ones you can just sell. Nature Made is a good example of the ones that really have no data behind them and could be anything in there. And they can really be harmful. So what they're finding in over-the-counter turmeric and curcumin supplements are things like the mentanil for the color, but they're also finding lead. They actually had a bunch of kids from Bangladesh come up with like high lead levels. They were not performing well in school, and they were trying to figure out where is the source, and it ended up being from a turmeric brand that was being sold in that area. So lead, as you probably know, is neurotoxic. It can damage the heart, can damage the brain, and the kidneys. So if you are going to buy the pill form of it, then get something that's medical grade quality. And we at our office, we sell something called Metagenics, and we have two really good brands that are called Intense and Flavonoid and something else in Flavonoid. We're going to include the links right here, but twice a day of one of the inflavonoids is going to really help you with the inflammation and the pain associated with that. It works great. Okay, so Cindy will put the link up there, which will be very helpful if you can check it out. And if you go to our website and get it, you get 20% off by ordering online, as long as it totals a certain amount. And then they do free shipping as well. So check that out. And then finally, and one of the reasons why I actually decided I really, really wanted to do a talk about pain, we have something that we have recently been using in our office, which a lot of chiropractors will have in their office. And actually, we brought it in because my husband's chiropractor said, you got to try this for your chronic back pain. And he tried it, and he's been pain free for a long time now. And these are called SPMs, or let me make sure I know what the specialized pro-resolving mediators. And this is actually the coolest thing. I have started to use this now with patients in combination with the inflavonoids. So what they'll do is they'll take one of these in the morning and one at night, and do the same thing with the inflavonoids. They work well together. The SPMs tend to be more chronic and long acting, whereas the inflavonoids can be a little bit shorter acting. But together they are a beautiful combination. And what these are, they are basically, they come from fish oil at the very bottom of the fish oil cascade as it breaks down. But you can't get it from fish oil because it breaks down too quickly when you take fish oil. So fish oil by itself helps the joints, and it also helps metabolism and other things, helps your brain function, so many benefits of fish oil. So you can continue taking that, or I would recommend you take some if you don't. It's unbelievable with the many differences that fish oil makes. But also add the SPMs to it. So pro-resolving mediators help promote resolution after physical stress of the body, after exercise, and they actually improve tissue health. So what they've shown in studies is that, and they've actually done hundreds of studies on the SPMs. The only people who make it is Metagenics, which happens to be the company that we have at our office. But what the studies have shown is significant improvement in three areas: comfort of the joints, so joint pain, joint comfort, sleep, and mood. All those things are made better by the SPMs. So the one thing I would say is, if you are allergic to fish, you can't take it. But if you're not, I have used these to get people off of, things as strong as opioids, all the way, down to, Tylenol, Motrin, all those things, because they've had problems either health-wise with those, or we're taking too much. And the beautiful thing about the SPMs is there's no side effects. I mean, I've not had a single person say I had to go off it because of a side effect. What I hear more often than anything is, I can't believe how well these work. And I took a trip this has just happened about 2 weeks ago. I took a trip. This is a woman who had bad osteoarthritis, really needs a joint replacement, and she was going to Europe. Took a trip with her family, was so concerned that she wasn't going to be able to make all the walking in Italy. And she's like, I cannot believe this was just totally different. I had way more fun, and I moved so much more than I ever thought possible. So I really like the combination of these two things. And oh, by the way, if we go back to the turmeric, it helps heart health, it helps brain health. A lot of these things that are natural, if they're made appropriately and made by a high quality process, can help with multiple things besides just the pain and inflammation. But definitely SPMs with the inflavonoids, the turmeric, curcumin, 1 tablet twice a day of both. Game changer, game changer, game changer, game changer. It's their best selling, and it doesn't cause damage to any of the kidneys or anything like that, liver, and makes a big difference in how you feel on a regular basis, which, again, it helps your sleep, helps your mood, and helps that chronic pain and inflammation. And the last part I will say about the pro-inflammatory mediators is they actually will clean up the surrounding tissue that is damaged. So they go in and they actually, I think about them like something that is just like kind of the sweep up crew that is cleaning up the mess, laying down the foundation for new healthy tissue to be placed on top. And then the whole process then is done, in a more efficient manner with better results. So these things are game changers. Okay, so, and then the final thing is the SPMs. So not the SPMs, weight loss itself. All right, now, weight loss for pain control. Who knew, right? Weight loss helps two ways. It helps the mechanical effects of the pain, so the actual weight and the joints kind of being smushed together if you weigh more. And this involves the back, the hips, believe it or not, the shoulders, and the knees. And what happens is, the mechanical pressure of the extra weight kind of mushes these two things together. And when you lose weight, I actually, you probably think I'm kidding, but it's true. People will grow, will check their height. And the reason is because now we have less pressure on the vertebrae. So they're standing taller and, they're not really growing, but they're standing more upright and there's less compression on the joints. So weight loss, 5 to 10% helps not just the mechanical piece, but it also helps the inflammatory piece that is caused by obesity. So 5 to 10% of your weight, if you're 200 pounds, that's 10 to 20 pounds, and you can make a huge difference in your inflammation and pain with just weight loss. So 1 pound of weight off your body takes 10 pounds of pressure off your back, 8 off your hips, and then 6 off your knees. So big difference for just a little bit of weight loss, which is great. What about glucosamine chondroitin? Hello there, energetic madre. Glucosamine chondroitin for arthritis. So when I first started practicing, this was a big deal, glucosamine and chondroitin. And they had some great studies in the past that showed that it did help with the cartilage component. But more recently, we haven't seen that it is, long term, that's really those studies are holding up as much. If you feel that it helps you, take it. It's safe. We know that for sure. But if you don't notice much of a difference, it's better to do something that's going to help, the inflammatory components chronically, which would be something like, turmeric or curcumin, and then the SPMs. So that's what I would recommend. If you're spending a lot of money on glucosamine, maybe try something else if you're not feeling a big difference. But that's a great question. I thought about including that, but then I just thought, really, it's not, I'm not so excited about it as I was, when I first started practicing. Okay, so let's do some question and answers. And if more people start to join, it's a beautiful Wednesday here in upstate New York. So I think it's like 75, sunny, and absolutely perfect. So I don't know if we're going to get a ton of people joining, but if not, energetic Madre and Cindy can answer all the myths. So for question and answer, I had Carol write. This is actually a patient I saw yesterday. She's like, I have an upcoming knee replacement surgery in 2 months, and it keeps getting postponed, which is happening a lot in medicine right now. I have tremendous pain, and my doctor just told me to take Tylenol and won't prescribe me anything else. What can I do? This is ever since we decided that, pain meds were bad and put bad label across pretty much all of them, now we're not giving people any relief as they wait for surgeries because we're worried about things like abuse potential. For someone who's, in this case, she's in her 70s and she's waiting for a knee and her surgery is getting postponed and she's just trying to at least be able to go grocery shopping and get the things she needs to survive while she's waiting for that process. This would not be a horrible application for a good pain medication, but we were so flogged when they made the change, when they decided that all opioids were very bad and all people who took opioids ended up with addiction problems. So now we got to change everything back over to marijuana, either medical marijuana or CBD, which works okay. But it was a false narrative, as happens when there's political gain for some of these things. It was certainly not a medical decision that was made. And now it made doctors really afraid. They were penalized for writing pain medications for the patients that really needed it, who didn't have any kind of abuse problems. So it's just it's so upsetting when we don't have control over our own field and we're just trying to do the best thing we can for our patients. CBD ointment, yeah, CBD comes in a lot of different forms. It can come in ointment, it can come in elixir, you can smoke it. If it's medical marijuana, a million different ways you can use it. CBD ointment, I like the elixir too. So here's the thing I'd say about CBD. Just be really careful about the THC component. Full spectrum has some THC. Broad spectrum does not. And the THC affects all of us differently. But some people can really, really have mental issues with it. It can affect their sleep, give them crazy dreams, and all the way up to, making some people want to have psychogenic issues where they're just, kind of seeing things and stuff like that, hearing things. So just be careful. You don't want to put something or take something that's helping your pain and then end up in, in the hospital on the psych ward for that. You definitely don't. So be careful with that. But I do like CBD elixirs and ointments if they're used appropriately for people who need it. And I think medical marijuana has a place. What I don't agree with, and I'll always be honest with you, is the way they did it by taking away things that were really working for people that don't have addiction problems. And now, doctors, they made doctors completely afraid because they threatened us if we did write them. I don't see that as being a very healthy way of dealing with chronic pain for our patients, unfortunately. Okay, so what can I do? So basically what I did with Carol is I put her on the SPM and the intensive flavonoid. And so we'll see how she does with that. I do this very frequently with my patients, try to get them off of what they're on or take care of it through the natural means while they're waiting for surgeries or other procedures. We do have a problem right now in medicine. Everything is kind of collapsing. So these kind of medications will get you over the hump, and you can use them chronically with, as I said before, minimal, if any, side effects, and they're great. So that's what I did with her. Okay, so Sandra wrote, I was put on gabapentin a long time ago by my primary care doctor, and I put on 40 pounds in 40 months. I'm afraid to stop it, but because I'm pre-diabetic now, but I'm not sure what to do. I'm scared that the pain will return. So frustrated. So I think we talked a little bit about cases like this. What I tell people is if you're on any of those medications, if you're on any medication for chronic pain, talk to your doctor about cutting it back if you aren't feeling bad anymore. And if you're on it and you don't know why you're on it, make sure you meet with your doctor and just find out if you can stop it completely. In the meantime, if you're comfortable and you are out of pain and the medication was prescribed for pain, you can try cutting back a little bit on your own, or even, over time, if there's nothing, just keep cutting back. And you may find that you don't even need it, or you just need a low dose. So with something like Neurontin or gabapentin, people get put on 4 pills 3 times a day. It takes a lot of Neurontin, gabapentin to make a difference with neuropathic pain. So then they stay on that very high dose, and they may only need 1 tablet twice a day to take care of their pain. And that makes them feel a lot better. They're less groggy, and they will sleep better, and also they won't have the weight issue. They'll actually start losing once they cut back. So, okay, those are the 2 questions I had. Should we do some myth busting, even though there's only a couple of you? Why not? Because people can join later. All right. And they can play on their own afterwards. So here's the first one. Opioids cause... Okay, I just talked about this. Opioids cause everyone to be addicted, and that's why they've been removed from the market. True or false? I kind of just gave you that answer with my big trap. I don't know if you're answering yes to that, true or false, and you answer yes. Okay, got it, Cindy, but I know what you mean. So, hell no. Okay, yeah, it's ridiculous. So the addiction potential, I'm going to be honest with you, I've prescribed these drugs my whole life, and I can't say that I've ever had, I've probably written hundreds to thousands of prescriptions over time. What they used to do to us as doctors is they made us, it's so interesting how these things get set up over time. They made us ask everybody about pain. And they had the happy faces. I'm sure you saw this. Sad face, happy face, 1 to 10, where are you, right? And if you were like a 4 or above, then we were instructed to write these medications. It's just crazy how this all happens. And then, this sudden shift about 4 years ago or so, 4 or 5 years ago, where they all went off. Okay, so people are acutely withdrawing from these medications, and now everybody's got to go on, CBD or medical marijuana, and suddenly these farms appear out of nowhere to support the need. So anyhow, makes me want to vomit. But that's the story there. So yeah, no. There's a time and a place for opioids. They've been around for a long time for pain. They work great. They're not without problems. They can cause constipation, there is an addiction potential to them with people who have chronic addictions. You got to be real careful. So if I'm got somebody who's an alcoholic who's getting a surgery, I'm going to be very, very careful how I write that, because addictions are addictions. It's a dopamine receptor issue, regardless of what the input is. But most people, especially if they're just using it to get to a surgery or immediately after, why can I only write 5? It's just ridiculous. It's absolutely ridiculous. So anyhow, but I can't fight this battle by myself. If someone is in need, I can write what I can write in our state. And then I can take care of the rest of it with something like the SPM and the intense flavonoids. All right, next. Okay, as long as I take Tylenol, this is the myth. As long as I just take Tylenol, ibuprofen, I'll be okay. True or false? Love your beach waves. Thank you. So, just Tylenol, just ibuprofen, true or false? I am going to answer it for you. So, as we talked before, you got to watch the liver. That's true. Trick question both. Yeah, you're right. Oh my gosh, you always get the trick questions, Madre. Yes, it is kind of a trick question. So it's okay to take, peppered dosing of Tylenol and ibuprofen. And even if you just take a low dose on a day every day, I'd still be careful of that, because it can affect other things some things we don't even know about. So what I like to tell people is this. So we know, as I mentioned, you got to watch the liver specifically with Tylenol, and you've got to watch the kidneys with non-steroidals like ibuprofen. I think of all the times, okay, maybe I'm oversharing, but I think of all the times in college when we go partying and then I'd take 1 or 2 Tylenols before I go into bed. I'm happy I woke up alive. I don't know what's going on now, but maybe it's just that everybody takes more, and who knows? Anyhow, but yeah, those are the things you have to watch out with those drugs. And I really like people to figure out the source of the problem. Okay, so if it's something that cannot be fixed, if you have a bad back and you've had 5 operations and they can't fix it, then you need to maintain a certain quality of life, and that makes sense to me. But if you have like a surgery that you're trying to postpone, and then like an orthopedic surgery, and you're loading yourself up on these things to postpone it, you're gonna be eventually having to face the consequences of that health wise. So if you can get the surgery and move on and live without that kind of stuff, it makes a big difference. And if you get a headache, there's usually a reason. So I see a lot of people taking Tylenol for just like a headache that just appears out of nowhere. Is it stress? Is it allergies? Is it sinuses? Is it something, don't just pop Tylenol or ibuprofen. Figure out what the source is. And if you deal with the source, like I used to have pain behind my eyes that was so bad after I had a car accident, and I had no idea what it was. And we had tons of sinus surgeries because I thought it was my sinuses. And it ended up being that there was actually something that was behind my ethmoid sinus that was blocking the sinus, and it was right behind my eye. And once that got fixed by, believe it or not, my chiropractor, I don't know, not chiropractor, she was the ones that do the needles, acupuncturist, was the one that was able to fix that and never had pain again. Unbelievable. So just, get to the source if you can. Okay. Sometimes I wrote these myths not knowing that I had already answered half of them. Sometimes I drink a little too much. I've always find this might be my question. I've always find Tylenol before I go to bed is the best way to prevent a hangover. It's safe, right? Okay. No, I'm lucky to be alive. You shouldn't do it. Do something else if you're worried. Actually, the best thing is so we have B12 vitamins that have a fat burner in our office, but B12 in general, or B vitamins, is the best way to prevent a hangover before you go to bed. If you take something like that and lots of water and go to bed, it will help. But I don't know why we're talking about hangovers. I guess that's a subject that was in my brain today. What is your take on medications and water exercises under supervision of a physical therapist to also work with inflammation. Absolutely. I mean, take on medications and water exercises. I'm not sure what medications you're talking about, but being in the pool, doing water aerobics helps. Any kind of exercise that you do will likely help prevent pain and inflammation just by the nature of what exercise does to your inflammatory components of your body that, affect stress and stuff. So I think that that's probably a very good idea. Okay, how we doing here? Okay, we'll just do a couple more. It takes a lot of weight loss to remove chronic pain, true or false? So I'll answer this so we don't have to wait because we're already coming up in an hour. It doesn't take much, right? 5 to 10% weight loss, that's it, can affect chronic inflammation, which is a huge component of the pain you deal with when you have obesity or even overweight. So that is, it isn't much and anyone can do it. So just really, focus on cutting back on your starchy carbs, on your sugar, on all those kind of things. Keep your water up, keep your movement up, and you'll thank yourself. It'll be better. Okay, and then my last one is natural remedies like turmeric or SPM don't work as well as pharmaceuticals. True or false? Yes, the weight loss should be fat mass. That's true. Energetic. You don't want to lose muscle. That's a big problem. So you got to keep, as you know, because you're a living example of this, you got to keep your protein up to prevent the muscle loss. And if you do, then you're going to be able to maintain beautifully like you have for so long. So the answer is false. Right. I really, there's some fields where I look at some of the supplements that are out there and, like for example, depression. Is there a supplement that really that treats depression as well as the SSRIs do? And I haven't found anything. There's something called SAMe that some people take. I haven't found that to be helpful. So it's not a good, pharmaceuticals in that case tend to be better than what I've seen out there for depression that are nutraceuticals. But when it comes to inflammation, there are so many plants and spices and even fruits and vegetables that are out there that help prevent inflammation. That we don't need to be on these drugs that are messing up our body long term. So that is a big fat false. You guys are right. Boswellia. Okay, yeah, yes. There's a lot of them. If you look up, this is something I've gotten into, and I'm really having a lot of fun with it. Believe it or not, it has nothing to do with weight loss or this topic necessarily, but getting out there and foraging and learning about the plants that are just in your neighborhood, or I actually go with a friend who's very, very good at this. She's from Taiwan, and this is what they do to sometimes get food when you have a high population place that doesn't have a lot of food available. And so anyhow, going foraging and looking at identifying the things that are out there and looking up both their food process or their food uses and then their medicinal uses, and you will find that, as it says in the Bible, every plant, every fruit, every vegetable, every tree has a purpose. Oftentimes there's a purpose both for to eating and then for medicinal value. So it's really pretty cool. Magnesium for inflammation. Is that what you're saying, Cindy? It definitely works for sleep. It works for your GI tract if you're having constipation. If it has inflammatory components to it, I don't even know. Oh, for pain, yeah, it can definitely help with pain. Yeah, magnesium. There's this big emphasis on magnesium right now. So I started to check all my patients because I heard, low magnesium can cause hypertension, cause this, can cause that. I rarely find someone who's low. So, but I do know that, we don't have as much in our food as we used to. And if you take it, a little bit of magnesium can help all those things I just mentioned, and pain as well, especially muscle pain, according to Cindy, which I believe because she's smart. All right, so we are at an hour. That went fast. So here's my closing remarks on all this stuff. You ready? Here we go. This is if you're watching this on replay, you can cut all the way to the end, and you're going to get everything you need. Here we go. Don't take pain meds if you don't need them. Okay, many doctors put you on them and never take you off, and now we're getting prompted constantly to refill things. And as I told you, I spend a lot of time doing that, and sometimes you can miss something and refill something maybe that you don't really care to refill. So anyhow, try to get off of whatever you can if you're really feeling good and pain free, or at least cutting down. It can make a big difference. Chronic use of pain meds causes other chronic problems. So you may be fixing one thing, but it can cause other problems: weight gain, kidney issues, GI issues, liver problems. We talked about all that. So less is always better. So if you can cut back, again, do it. And if you can cut off, that's even better. Or substitute something that is safe and effective, like that is natural. So, my third point is CBD and medical marijuana do work, but you got to be really careful with the THC components, and they don't work for everybody. So, try it if you're having trouble finding a way to deal with your chronic pain, because the CBD, especially if you get good CBD and stay away from the THC, so you get a broad spectrum, not a full spectrum. It can work for a lot of people, and it also can help with sleep. So you can take it before you go to bed. I do have some friends that do that, and it helps for that as well. Natural supplements, as we mentioned, like turmeric and curcumin and SPMs, are game changers with minimal, if any, side effects. So get your hands on that. What Cindy just posted was our supplement website. You can check and see what else we have on our website that's from Metagenics, which is a medical grade quality, which the FDA does get involved in medical grade quality labs. And they do clinical trials on all their stuff. So if they say that it does these things, they have proof by clinical trials that it does. We all take their products. I take 4 different supplements a day from them every single morning, and they're great. I feel great. Okay, and what else? Oh yeah, be really careful if you're getting turmeric, curcumin over the counter for the reasons that I mentioned. We really should do something on just what kind of things you want to look for in your supplements and what kind of things you want to make sure are not in there, because the fact that they're not regulated at all and they're being sold in every supermarket, gas station, everywhere, you really shouldn't be taking anything that you don't know about, and don't believe that just because it's a supplement that it's been tried and has high quality, because many of them don't. They're just there to make a buck. Okay, and don't forget weight loss as a tool to help with pain and inflammation. All right. And always remember, okay, so Energetic says, always remember when in doubt. Yes, girl, I'm so with you on this. Just take some dark chocolate, which does help inflammation and taste yummy. All right. So thank you for those of you who joined, and watch the replay if you didn't. And I hope you guys have a great day and a great night. And I'll see you soon on my next Facebook Live. Take care.